So, hello everyone. Good evening. Myself, Dr. Tanema Singhal, and I welcome you all on this today's session on Ask Me Anything related to breastfeeding your baby. So, as we always do, I will first start with answering the questions which have come on the Google form, and then I'll take the live questions. So, if you have any questions, you can write in the Q&A box, and I'll answer them later on. So, I'll start with first question. First question is from Usha Shri. In insufficient milk for 3 months baby. So Usha, if you have low milk supply for your 3-month-old baby, then first of all understand that 3 months is a growth spurt period. So maybe that supply is not less, but you are feeling that way because of the growth spurt. So growth spurt is the time when the body of the baby is growing very fast. So the baby's demand increases and mother feels her supply has gone down. So if you are seeing that the baby's weight gain is good, the baby is gaining around 100 to 150 grams per week, then don't worry, your milk supply is not low. Just try to frequently feed your baby and that will be okay. So first, Usha, just see if your baby's weight gain is fine. If the baby's weight gain is fine, then don't worry. If you're live right now, please write in the Q&A box what is the last weight gain of the baby so that I can assess whether it is a growth spurt issue and or you are really going through a low milk supply thing. Okay. Next question is from Supriya. My milk supply is low. So Supriya, if your milk supply is low, then what you need to do, you need to first of all understand the concept about improving the milk supply, or we can understand what is the basics of breastfeeding. So when we talk about basics of breastfeeding, it is about the demand and supply. When our baby is born, there is enough milk for our baby. But if for any reason baby is separated or baby is given formula milk from above, or the mother is not able to breastfeed her baby due to any reasons, there is a gap in the demand. So the brain takes whatever the milk is there in the body, the brain takes it as an extra milk and it starts reducing the milk supply. So overall, if we have to revert the process, we have to first improve the demand and supply chain. So in order to improve the demand and supply chain, if your baby is already coming on the breast, then try to feed the baby frequently, and along with every time whenever you're giving formula feed, just try to feed your baby directly. If your baby is not coming on the breast, then you have to create the demand by pumping. So whenever you're giving formula milk to your baby, that time you need to pump. If you have already tried everything for last 10 days, if it is more than 10 days or 10 days, then there is no reason to stay and keep trying with all tips and tricks. Reach out to the expert and get your consultation done so that you can resolve the issue as fast as possible. Because if it is 10 days or more and you have been trying for it and not seeing any results, then there is no benefit of staying back or waiting for it to improve. Now, along with demand and supply, what you need to do, you need to focus on few more things. First of all, the hydration. So have at least 3 liters of water every day. Second is improving the flow. To improve the flow of the milk, do oil massage on the breast and then warm compress. Third is about any kind of galactogogues which you are taking. If you are taking any medicines any medicines, so all of you who are present today, if you are taking any kind of medicines, please just see the backside of the medicines if there is any preservatives added into that. If you see any preservatives added into that, please don't take them. So preservatives, usually the section in this section, whatever medicines are available, they usually have methyl benzoates, or they have methyl sulfates, or they have methyl parabens. So any of these 3 things are not good. You would have seen ads coming on TV as paraben-free shampoos, paraben-free creams. So if we don't use creams or shampoos for local application, we can't take them for our milk supply, or we shouldn't take it inside our body, especially when we are nursing a small baby. So all of you, whoever are taking medicines from outside, from medical stores or advised by any of your doctor, please see the backside that there should be no preservatives added into that. So if you ask me preservative free options, then I usually recommend Lactomagic powder and Morico tablets. Along with this, if your milk supply, if your formula milk is more than 4 times per day, then we recommend some other medications which we can advise only if we know what is your present and the past history. So along with the medications or any kind of galactogogues, what you can do, and yeah, many mothers keep asking me that suggest some home remedies for this. So always remember, there are many home remedies which you would have also encountered, or somebody would have told you about the home remedies. But always remember, home remedies is not a sure shot. First of all, there is no proper dosage of that how much of any ingredient is required for your body. Second thing is, one thing may not work for the other mother. So when we talk about home remedies, if you have already tried them for 10 days or more, and if it is not working for you, then please don't tips and tricks and don't try all these things. Reason being, your baby is, by the time the mother realizes that there is an issue, it's already time has gone. After 6 months, baby will be added solid food. So that's why there is no point in waiting for magic to happen or some things to resolve by its own. You need to just take a fast action and get your issues resolved as fast as possible and as soon as possible. So if your baby is more than 2 months or 3 months, please, you're already late. So just try to reach out to the expert and get your issues resolved fast. If your baby is less than 1 month and you have already tried for 10 days and it is not improving, then also there is no point in waiting. Also, whenever we are working on improving the milk supply, or we are trying to improve our breastfeeding journey, the most important thing is knowing whether we are going correct or not. So for that, you need to see the baby's weight gain every week. If your baby is gaining weight regularly and the formula milk is coming down, that means that you are on a correct path. Along with all these things, you need to also keep your baby skin to skin. That helps naturally to improve the milk supply in your body. So all these are the tips for improving the milk supply. Once your milk supply is good, you can also start working. If your baby is not coming on the breast, then you can start working on latching also. If your baby is already coming on the breast, just try to feed the baby frequently so that there is a good demand and supply made in your body, so that the milk supply can improve. So next question is from Ankita. While following protocol given, just a minute. While following protocol given, some pumping sessions get delayed due to some reasons. Then how to manage upcoming pumping sessions? And if more than one pumping session time disturbed, then what to do? So first of all, always remember the pumping protocols which are given to you are all scientifically designed in a way for the body to respond and give you results. So suppose if you miss a session one single day, it's okay. But try to keep the sessions on its place. Half an hour here and there is fine. You need to understand the concept why we are working on the same time. If your body is given if suppose if you are given pumping protocols by our doctors, that means your milk supply was really low, so that why, or the baby is not coming on the breast regularly, that's why pumping has been given to you. So if we create the demand regularly at a same interval of time, then our brain will get the stimulus better way, and it will respond in a better way. So it's like imagining that if you are given false stimulus about cooking food, then for few days you will cook, but otherwise you will, like, suppose somebody says that I'll come to your home today, please make some good dish for me. You cook something good and the person doesn't come to your home. After 2 3 days, the person again says to you that I'll come to your home, cook a good food for me. You might cook for that person, but if the person doesn't come, you will always take it as a false stimulus. So if you're pumping once or twice, or you're pumping regularly and missing in between, the brain will take it as a false stimulus. So if it is improving the milk supply, if it takes that as a false stimulus, the supply might go down or might not increase as per the expectation, what we expect from our body. So try to keep your pumping sessions on time. Half an hour here and there is okay, acceptable. On one particular day, if it is missed for any reason, it's okay. Just from next day, try to be on your proper protocol timings. And still, if you are not able to follow due to any reason, then still, this I'm just saying as a disclaimer, if you are not able to follow anything, Whatever you are able to follow, just follow and reach out to the expert. They will understand your situation and will try to modify if there is any scope of modification. If your supply is really low, then there is no scope of modification, because we want you to get results. If we try to modify the protocols and the supply is already very low, then we will not be able to create sufficient demand. So if it is all depending on person to person or mother to mother, what is the supply, what is the final goal we want to achieve, what is the age of the baby, how much formula is being given. So that's why protocols can be modified, but depending on what is the status of the mother. If there is no scope of improvement, scope of modification, then we are also helpless, because we want best results for you. So anyhow, if you're, whatever the way you are able to follow, just follow and reach out to the expert, and they'll listen to you and they will guide you accordingly. Okay, Ankita? Okay. नेक्स्ट क्वेश्चन इज फ्रॉम आयशा, क्रैक निपल कैसे ठीक करें? तो आयशा, सबसे पहले अगर आपको क्रैक निपल हो रहा है तो ये बहुत क्लियर इंडिकेशन है कि या तो आपका लैचिंग का इश्यू है, आपका लैचिंग शैलो है। दूसरा चीज, या तो मिल्क सप्लाई बहुत लो है, बच्चा बार बार ब्रेस्ट पे बहुत मेहनत करता है, बहुत खींचने की कोशिश करता है, उसको मिल्क नहीं मिलता, जिसकी वजह से क्रैक्स पड़ रहे हैं। तीसरी चीज, मिल्क का फ्लो बहुत कम है। अगर फ्लो कम है तो बच्चा तेजी से खींचने की कोशिश करेगा, जिसकी वजह से आपको क्रैक्स होंगे। तो पहली चीज, आप लैचिंग पे वर्क करोगे। क्रॉस क्रेडल होल्ड बहुत अच्छा काम करता है उसके लिए। आपको ये इंश्योर करना है कि आपका निपल आपके माउथ के पीछे वाले, बच्चे के माउथ के पीछे वाले भाग में जाए। तो आप इस समय, आप लोग जितने लोग यहाँ पे प्रेजेंट हो, सब लोग एक मेरे साथ एक्सरसाइज करेंगे। अपनी टंग को ऊपर वाले पैलेट पे टच करेंगे। आप जब टच करेंगे तो आपने एक चीज ध्यान देनी है कि पीछे की तरफ आपका वहां पे एक डोम जैसा आपको फील होगा। तो आप इसको, हम लोग पीछे वाला जो पैलेट होता है, यहाँ पे डोम होता है। ये इसलिए होता है, इस तरह की एनाटॉमी बनाई है बॉडी की, कि जब आप बच्चे को लैच करते हो तो बच्चे के यहाँ अपर पैलेट के ऊपर मदर का निपल सेफ एंड सिक्योर रहता है। डीप लैच होता है, प्लस यहाँ पे निपल सेफ एंड सिक्योर होता है। और अब आप लोग एक और चीज, अपने टीथ के पीछे वाला पार्ट पे टच करो। यहाँ पे हार्ड पैलेट है। ये वाला पार्ट बच्चे के माउथ का आपके ब्रेस्ट के एरियोला पे रहेगा। जब एरियोला पे रहेगा और उस पे बच्चा जब लैच करेगा, तो मिल्क का फ्लो, मिल्क का एक्सप्रेशन ज्यादा अच्छा होगा। बच्चा ब्रेस्ट को जल्दी खाली करेगा और आपका मिल्क सप्लाई भी इंप्रूव होगा, क्योंकि जितना ब्रेस्ट खाली होगा, मिल्क सप्लाई भी उतना तेजी से इंप्रूव करेगा। तो डीप लैचिंग टेक्निक्स बहुत इंपॉर्टेंट है। आप अपने जब लैचिंग टेक्निक्स को इंप्रूव करोगे आयशा, तो आपका क्रैक निपल्स का इश्यू ठीक हो जाएगा। अगर आपका मिल्क सप्लाई अच्छा है और आपको खाली लैचिंग के इश्यूज आ रहे हैं, तो आप, हमारी टीम में हमने एक लैच एक्सपर्ट हमारे पास हैं जो कि सिर्फ लैचिंग पे हेल्प करती हैं मदर्स को। तो अगर आपका मिल्क सप्लाई अच्छा है, सिर्फ लैचिंग का इशू है, तो आप टीम से बात करके लैच एक्सपर्ट के साथ अपनी कॉल लगवा सकते हैं आयशा। नेक्स्ट, my baby will be 6 months old soon. Can I start feeding him in sleeping position during? Also, till which month do I have to burp the baby post feeding? So Pranali, if your baby is completing 6 months, you can definitely start feeding the baby in sleeping position, and just make sure that the baby's latch is good so that the baby can empty the breast faster. Second thing about burping is, if you see that your baby is burping every time regularly, then obviously you need to burp. But in slide lying position, how you can burp, you will place the baby on your hands, like when you are feeding the baby. So once the baby has fed, you can just raise the baby and put the baby with your chest and just swaddle the baby like this so that the baby can burp. So this way you can burp the baby easily. But burping is important. See, for elders, it is also important. So because if the baby doesn't burp, there are chances that while the baby passes the air, like releases the air, the milk might come up. So that's why burping is important. If the baby has passed air from below, like farted during the feeding session, then you can skip the burping part. But otherwise, it is important. Next question is from Himali. How long domperidone can be taken for increasing milk supply? This you have to talk to your doctor. We can't, I just don't know because how much you have taken, although it can be taken safely for 8 to 10 weeks. And also the doses will change. It starts at 4 tablets per day and it can go up to 8 tablets per day, but it should be always taken under the doctor's guidance only. Because it is an allopathic tablet, it should not be taken on self-medication. Next question is from Revati. Latching and want to skip formula. So for latching, you need to follow the proper latching techniques. And if you want to skip the formula, then obviously you need to first improve your milk supply. So Revati, first part, when we talk about latching, then you have to make sure that there is a deep latch. The baby should be doing active feeding and not passive feeding. So how you will differentiate between active feeding and passive feeding? If you can see the gulping movement of milk in the baby's mouth, in baby's neck, while the baby is feeding, that means it is an active feeding. If the baby is not doing the gulping movement, that means the baby is sleeping on the breast. Second part is, if like for improving the latching, there are a few pointers which you need to notice. First of all, baby's chin should be touching the breast of the mother and fully embedded into that. Second thing is, baby's mouth should be wide open. Third, baby's lips should be on the junction of areola and the breast. Fourth, the cheeks of the baby should be coming they should be like rolling out. There should not be any dimpling while the baby's feeding from the breast. And also the baby should be looking up, the nose should be away, and chin should be touching the breast and embedded in the breast. So these all pointers are important to know whether your latching is correct or not. So you just need to work on this. And when we have mothers reaching out to us, we always we ask them to send some videos. So, and in a way that we should see only the lips of the baby, so that we can see and we can assess the latch and can guide the mother on improving the latching also. Next question is from Rakesh. So I think either the father has written the question, or the mother has written it from the husband's profile. So I think it is Parul Roth. Okay, Parul Raut. So the question is, my baby is 5 months old. Since last 2 months, we are facing issues pertaining to his feeding cycle. We have to make him sleep to feed, or else he will not take feed. Pediatrician suggested us to wait for him to get hungry, then automatically he will take. But even after keeping him hungry for 6 hours, he didn't ask for feed by himself. Due to this, last month he lost around 500 grams. Since then, we have been making efforts to make him sleep every 2 to 3 hours for feeding. Also, he will not sleep on his own. It's taking our too much time and efforts, and we are ending up exhausted. Please suggest what to be done. So your baby is 5 months old, and this thing is happening since 3 months, which is a very clear indication that this has been happening since the growth spurt time. Why does it happen? Because the babies get distracted and easily, and they want to just play. Because feeding for them has become a granted thing. They know that whenever I want, I can get milk. And also because they get distracted very soon. So there are a few tips which you need to just make sure, and obviously this will be okay. And also sometimes it happens due to nursing strike. Recently, one of our mother reached out. She was our old mother, and she reached out to us with a complaint of nursing strike. Her baby was not taking feed at all. In your case, the baby is taking feed, but only in the sleeping position. So in the sleeping, when the baby is sleepy, the baby is taking feed. That means the baby needs, and baby knows how to take milk, how to suckle, but the baby gets distracted when the baby is awake. So few pointers which you need to follow is: number one, try to keep the lights of the room little dim. Second thing, there should not be more toys or some people just calling out the name. Sometimes what happens when the baby is not feeding, people try to distract by making some sounds or by calling out the names. So don't try to distract your baby. Third thing, if many people have a habit of putting some noises, like they are putting some white noise or something like that to feed the baby. So don't try to do that. Just keep the babies calm and quiet at a position. Fourth thing, many times the babies are very playful while the feedings. So if they babble or if they try to communicate with the mother, it's a very cute thing to see, and the mother also responds. So babies take it as the mother is talking to them, and they don't feed. They just look at the mother, smile, and they just want to play. So in that situation, if you are feeling the baby wants to talk to you, just make it a habit that don't try to speak at that time, but once the feeding session is done, just give ample time. Just spend 5 to 10 minutes with your child. So your baby will understand that this is a feeding time and that is a play time. So this all things you need to incorporate when you are raising your child. So these things are very important even for discipline while your baby starts seeing food, start eating solids. Many times mothers say that my child doesn't eat, I need to run after my child to give him solids. So that's why you need to understand, you have to put this discipline from very early, like when your baby is 2 months or 3 months, because that is the starting position of all these things. So from that very time, you need to just follow all these things. So right now, you need to just make sure that your baby's distraction is removed so that the baby can take feeds directly. Next question is from Mathi. Hi, my baby is 47 days old. She is still at birth weight. Worried breast milk is not enough. Should I start formula milk along with breast milk? So 47 days, yes, if the baby is still on birth weight, obviously you need to work on this. So what I recommend, for a few days, you can start giving more of hind milk. Even after every feeding, just express the milk, give that milk to your child, watch for 1 week, take the weight on day 1 and day 7. If the weight is still not increasing, please don't waste time there. And although I recommend right now also that baby is already 47 days, not gaining weight, just reached the birth weight. So better to reach out to the expert as soon as possible and get your issues resolved. We can definitely increase the weight of the baby with exclusive breastfeeding by giving more hind milk to the baby. After every feeding session, just try to express or pump or try to give more milk to your child. Just express the milk and give that milk to the baby. And the more expressions we can do with after feeding the session, so you can see the thick white milk coming afterwards, and just feed your baby more with this, and the baby's weight will increase. We have many cases where the same situation, that the baby was not increasing weight with exclusive breastfeeding, and baby had to given formula milk because of this, and we removed all the formula milk by giving this hind milk to the child. And few mothers reached out in the same situation, that I have been advised formula milk, but I don't want to give formula milk. Is there a way to improve breast milk supply? Improve weight gain of the baby with exclusive breastfeeding? So this is easily done, and it can be easily done. But it's better you reach out to the team and get your expert guidance, so that they can be with you regularly to see the weight gain, and you can just work on this without giving any formula milk to your baby. Sushma, my kid is 3 months old. She's taking for feed every 1 hour during evening times. Is she not getting enough milk? So Sushma, your baby is 3 months old. Right now, the baby is going through a growth spurt. This is perfectly fine. The growth spurt periods are 2 weeks, 6 weeks, 3 months, 5 months, 7 months. During this time, if your baby is gaining weight around 100 to 150 grams per week, then don't worry, Sushma. There is no problem with it. But if your baby is not gaining weight, then definitely there is a dip in the supply, or the baby's demand has increased, and we need to improve your milk supply so that the baby can get enough milk. So if your baby's weight gain is if you have checked the weight gain and it is 100 to 150 grams in a week, then don't worry, everything is fine. This is because of the growth spurt the baby is asking frequently. It will be okay very soon. Next question is from Kirti, how to latch? So for latching, I would always suggest to go for cross cradle hold if you are having issues related to latching. And how to do a cross cradle hold? Just keep the baby on the lap with 2 or 3 pillows below you. The height should be sufficient that the baby should reach the breast of the mother. The mother should not go down, should not bend to put the baby's to give breast to the baby. Better to bring the baby towards the breast. And how you can do with cross cradle. If you have to feed from the left breast, then hold the baby with the right hand. Hold the breast in U shape from below the left breast. And then once you are feeding the baby, just press the breast so that the areola is pouted outwards. When you are bringing the baby, just make sure that the baby's head is extended. When the baby's head is extended, the lower lip, just stimulate the upper lip of the baby with your thumb, like nipple with your on the upper lip. And once the baby opens a big mouth, then take the baby inside. Once the baby is inside, just make sure that your nipple should be pointed towards the upper palate and not in the middle of the mouth. If the baby's if your nipple is pointing towards the upper palate, it is well and good. But if you see that your nipple is pointing towards the middle of the mouth, just extend the baby's head in a way the baby's head should move backwards, so your nipple will be pointing towards the upper palate. So this way latching issues can be resolved. So this is an answer for you to improve your latching. And if you are having any issues related to latch, you can reach out to our team. We have a dedicated latch expert in our team, and she will help you out. Next question is from Shivi. Very, very low breast milk supply. So when you say very, very low milk supply, I understand that you would have tried a lot of things, Shivi. So I have given tips and tricks today for improving the milk supply. But when you say very, very low breast milk supply, then there is no reason to wait for improving the milk supply on its own. Get your issues resolved by reaching to the team as soon as possible. Next question is from Noor Smira Laskar. The question is, does it really work? My baby is 1 month and I don't have breast milk. So yes, it definitely work. If you want to, if you are not sure whether it works or not, you can just see our YouTube channel. So on our YouTube channel, we post regularly success stories of the mothers who are reaching out to us, getting their issues resolved. We have a Mom Star series there where we are regularly putting the success stories of the mothers. So if you have any doubts about it, you can just watch the Momstar series on our YouTube channel. So on our YouTube channel is if you just type Dr. Tanima Singhal on YouTube, you will get my channel. Next question is from Priyanka, low breast milk supply. So Priyanka, I've already answered about this. So if you have joined late, you can just watch the recording. I have answered it already. Next question is from Shruti. I have been feeding my baby 10 times daily. After every feeding session, the baby wants formula too, and there is no improvement in the overall breast milk production. So if your baby is taking 10 times daily and you are feeding the baby regularly, what is the weight gain of your baby, Shruti? Just tell me about the weight gain of 1 week and let me see what is the problem there. Next question is from, what is the next question? Afshan Akhtar. The question is, I'm following your treatment for last 1 month, but still my supply is low. Baby rejected my breast and I'm giving bottle to her. How can I improve my milk supply? I don't want to give formula milk. Please help me. I'm regularly pumping my breast also. Now, how can I improve my milk supply? Thank you. So Afshan, first of all, please write on in the chat box, what is the age of your child? What is the last last week's weight gain? And then I'll help you about it. Next question is from Hannah. My baby doesn't latch at all, even after when the milk when the milk flow was better. Please suggest. So if your baby is not latching directly, what you can do, if your milk supply is good, and then first of all, see if your baby is habituated to the bottle, you need to first improve the flow of your milk. If you have a good milk, but the flow is less, then work on improving the flow. Then what you need to do whenever you are giving baby the bottle feed or whatever you're giving, palada or katori or whatever, first try to put the baby on the breast. If the baby doesn't latch, doesn't cooperate, you give bottle or palada or katori, whatever you are giving, whatever amount of milk you are giving, first give half of the amount and then take the baby back to the breast. Just try and keep doing this persistently on every feeding session. It's not like if the baby is taking 8 times, you try 2 to 3 times. You need to work on every feeding session and at least 1 week. And then if the baby starts latching, that will be well and good. So this you need to follow when your milk supply is good. If your milk supply and flow is not good, then I would always suggest you to first work on that so that later on we can work on getting the baby on the breast too. नेक्स्ट क्वेश्चन इज फ्रॉम सुप्रिया. मेरे ट्विंस बेबी हैं, मैं मासी केयर से ट्रीटमेंट भी ले रही हूँ, फिर भी मेरा मिल्क सप्लाई क्या है, फिर भी मेरा सप्लाई है, क्या करूं मिल्क बढ़ाने के लिए? ओके, तो अगर आप ट्रीटमेंट ले रहे हो तो आपको क्या प्रॉब्लम आ रहा है, आप मुझे ये बताओ, क्योंकि आपने लिखा है कि मैं मिल्क सप्लाई बढ़ाने के लिए क्या करूं. तो आपको अगर ऑलरेडी ट्रीटमेंट ले रहे हो तो आपको उन्होंने एडवाइस किया होगा कि क्या करूं. तो आपको ऐसा क्यों लग रहा है कि आपका मिल्क सप्लाई नहीं बढ़ रहा है? आप मुझे एक बार चैट बॉक्स में लिखिए, आपको क्यों लग रहा है, आपके बच्चे का कितना वेट गेन है लास्ट वीक का, आप कितना फॉर्मूला पहले दे रहे थे, अभी कितना दे रहे हो. आपके ट्विंस हैं तो ऑब्वियसली आपको टाइम का इशू भी आता होगा. आप कितनी बार ट्राई कर रहे हो, जो प्रोटोकॉल्स आपको दिए गए हैं क्या आप रेगुलरली फॉलो कर रहे हो, क्या आपको जो मेडिसिन की डोजेस वगैरह बताई गई क्या आपको फॉलो कर रहे हो, ये सारी चीजें मुझे सुप्रिया लिखो. आप लोग आधा अधूरा लिखते हो, मुझे कैसे पता चलेगा? प्रॉपरली लिखो, वेट गेन लिखो, ये सब चीजें लिखो तो मुझे समझ में आए। नेक्स्ट क्वेश्चन इज फ्रॉम रानी। आई एम फ्रॉम कोलकाता। मेरा बेबी 1.5 मंथ्स का है। लैचिंग नहीं करने की वजह से उसे मैं फॉर्मूला दे रही हूँ, पर मैं उसे ब्रेस्ट फीड करवाना चाहती हूँ। पंप करने से ज्यादा मिल्क नहीं आता, 100 से 120 ml के करीब पर डे आता है। तो अभी आप कितनी बार पंप कर रहे हैं? और आपको बेसिकली अगर आपका 1.5 महीने का बच्चा है तो अभी हम इनको आराम से ब्रेस्ट फीडिंग डायरेक्टली भी करा सकते हैं। 1.5 महीने का बच्चा बहुत छोटा होता है, हम आराम से इसको लैचिंग सिखा सकते हैं। अगर मिल्क सप्लाई आपका 100 ml से 120 ml के बीच में आ रहा है तो ऑब्वियसली ऐसा भी नहीं है लेकिन कि बहुत लो नहीं है। हम ट्राई करा सकते हैं, जो मैंने अभी तरीका बताया मिड बॉटल फीडिंग और मिड कटोरी फीडिंग वाला, उसको आप ट्राई करो। बाकी पंप ऑब्वियसली बात है, अगर आपका कम आ रहा है, पहले आप मुझे ये बताओ कि कितनी बार आप पंप कर रहे हो, आपका बच्चे का फॉर्मूला मिल्क कितनी बार है, डिमांड सप्लाई चेन आपकी प्रॉपरली मेंटेन है कि नहीं। इस चीज को हमें पहले समझना होगा, उसके अकॉर्डिंगली हम समझ सकते हैं कि इसमें और क्या किया जा सकता है। नेक्स्ट क्वेश्चन इज फ्रॉम रोहिता। I have 33 weeks premature baby. Now he completed 3 months. He can't latch properly. I tried a lot now giving breast milk and formula milk in the bottle, but he won't drink much. He gets very tired easily, and due to this, my milk supply became low. Please suggest me. Latching, and you are giving breast milk and formula milk in the bottle, but he won't drink much. So what is the weight gain? If his weight gain is going fine, then just try to reduce formula milk regularly and try to give more breast milk, and try to latch as I just suggested with the mid bottle or mid katori feeding. And if the baby starts gaining weight properly, then why do you want to supplement with the formula milk? So Rohita, you just need to understand that what is the weight gain of the child. You need to just track your baby's weight. If your baby's weight gain is going fine, then you don't need to start like give formula milk by giving like by forcing your child. You can start reducing formula milk if your baby's weight gain is perfectly fine, like if it is going fine. Next question is from Radha Chaudhary. Low breast milk in and that also sudden drop of milk production. So sudden drop of milk production will always come if there is a sudden disruption in the supply demand chain. Many times mothers are telling me, I went to a marriage and that time I couldn't feed my child. I don't understand that by going to a marriage, that how can you like stop feeding the baby? Because if the baby is crying and if you are giving bottle because you are in a marriage, then obviously this is not justice to your child. So if you want that if there is sudden drop of milk production, there is something, a gap between the demand and supply. So you need to understand rather whatever thing has been done, like whatever, because you would be knowing that what was the cause, that why this the demand supply chain was disturbed. So you need to understand that and work on reversing it. Once your supply demand chain is maintained, the milk supply will be back on the track. Next question is from Suman. हाउ टू इंक्रीज माई ब्रेस्ट मिल्क। मेरा बेबी 2 महीने का है, पहले तो ठीक था मिल्क, पर 1.5 मंथ से धीरे धीरे मिल्क कम हो गया। मैं पंप टेक्निक भी यूज की बट उससे कुछ इफेक्ट नहीं हो रहा है, क्या करूं? मेरा ब्रेस्ट मिल्क बेबी के लिए क्या लिखा है? मेरा ब्रेस्ट मिल्क बेबी के लिए सफिशिएंट हो, क्योंकि मुझे फॉर्मूला मिल्क देना पड़ता है जो कि मैं नहीं चाहती हूँ देना। प्लीज मैम मुझे गाइड मुझे बेबी को एटलीस्ट 6 महीने तक सिर्फ ब्रेस्ट फीडिंग ही कराना है। ठीक है, तो सुमन मैंने अभी कुछ चीजें बताई हैं आपको, लेकिन आप ये कह रहे हो कि 1.5 महीने से लगातार मिल्क कम हो रहा है। तो 1.5 महीने से मिल्क कम हो रहा है, आप इतना ऑलरेडी 1.5 महीना हो गया है ये कम होते होते, अब आप और इसका वेट नहीं करो, आपका बच्चा ऑलरेडी 2 महीने का हो गया है, 1.5 महीने से मिल्क सप्लाई कम हो रहा है, आप किस चीज का वेट कर रहे हो सुमन? इसको फौरन ठीक करिए। आपने बोला कि आप 6 महीने तक फीडिंग कराना चाहते हो, 6 महीने क्यों, आप लंबा फीडिंग कराओ। 6 महीने तक ही क्यों कराना है? बाद में बच्चे को जब सॉलिड स्टार्ट हो जाएंगे तो भी आप फीडिंग कंटिन्यू रखना। WHO कहता है 2 साल और उसके ऊपर, बाकी आपकी मर्जी है, आप जितना लंबा चाहे तक फीडिंग कराओ। तो खाली 6 महीने का मत सोचो, लेकिन 1.5 महीने से अगर मिल्क सप्लाई लगातार कम हो रहा है तो अब आप किस चीज का वेट कर रहे हो सुमन? इसको जल्दी से जल्दी रिजॉल्व करिए जिससे आप अपने बेबी को एक्सक्लूसिव ब्रेस्ट फीडिंग करा पाए। Next question is from Varna. Why does my baby fuss and cry sometimes even while being latched? This shows that you have a flow issue. So just try to improve the flow by doing oil massage and the warm compress. Once the flow will be good, the baby will not fuss on the breast. नेक्स्ट क्वेश्चन इज फ्रॉम ऋचा शर्मा. बच्चे के दांत आने के कारण वो बहुत चिड़चिड़ा हो गया है, ठीक तरह से दूध नहीं पी रहा है. बेबी 6 महीने का है. तो दांत आने के कारण अगर चिड़चिड़ा हो गया है तो आप इसके लिए ऑब्वियसली अब हम समझ रहे हैं कि बच्चे के दांत आ रहे हैं, वो बहुत चिड़चिड़ा हो गया है. तो उसके लिए जो टीथर्स आते हैं, जो सूदर्स आते हैं, वो आप बच्चे को थोड़ी देर के लिए दीजिए, जिससे बच्चे के गम्स में आराम मिले. जब बच्चे के दांत आ रहे होते हैं तो जब दांत गम्स में मतलब जो मसूड़ों में चल मूव करते हैं तो वो बहुत इरिटेटिंग होता है, बच्चे को बहुत दिक्कत होती है, बहुत पेन भी होता है. तो आपको ध्यान ये रखना है कि आप बच्चे को फीडिंग से पहले थोड़ा वो दें, सूदर्स दें, या जिसको हम लोग टीथर्स बोलते हैं, जिससे बच्चा उसके ऊपर निबल करेगा तो उसके दांतों में, उसके मसूड़ों में आराम मिलेगा और बच्चा इजीली ब्रेस्ट फीड कर पाएगा. दूसरी चीज, आप बच्चे को दिन में 3 से 4 बार उसके ये हेड पोर्शन में यहाँ पर रेगुलरली ऑयल से मसाज करें. एक सर्कुलर मोशन में मसाज करेंगे, ये वाले पोर्शन में बच्चे के मसाज करेंगे, थोड़ा मसाज करेंगे तो उससे बच्चे को आराम मिलेगा, जिससे बच्चा अच्छे से फीडिंग कर पाएगा. आप ये दोनों चीजें रेगुलरली करिए, इससे ये सब चीजें ठीक हो जाएंगी. नेक्स्ट क्वेश्चन इज फ्रॉम कानी. He is 11 months old. He taken formula milk. How to feed good latching for breast? So today I have just given you a tip of a good latching. Just watch the recording if you have joined late, or if you are live right now, you can just message me on Q&A box that anything else you want on this. So these were the questions which came on the question answer. Now let me start taking the live question answers. So first question is from Rohita. Suddenly my milk supply became low by pumping. I already answered about this, Rohita. Next question is from Shruti. My baby is 49 days old and every time I breastfeed, she also needs formula. I am feeding her almost 8 to 10 times in 24 hours for the last 5 days. Please suggest what to do. So Shruti, I think I answered your question also. Shruti. Yes. So I have answered your question, Shruti. Next question by Radha is uneven milk supply. So it's okay, Radha, because see, we are mothers and it's a natural body. It's not a machine. It will not make the same amount of milk as it makes the whole day. So mornings, the milk supply would be better, and by evening, the milk supply goes a little lesser. But it's perfectly fine. It will get adjusted as to your demand of the baby. So just keep feeding your baby regularly, just seeing the weight gain of your baby. If your baby is gaining weight, then don't worry about the uneven milk supply. नेक्स्ट क्वेश्चन इज फ्रॉम सुमन शॉ. मेरा मिल्क मेरा बेबी के लिए सफिशिएंट नहीं हो रहा है. वो 2 महीने का है. उसका बर्थ वेट 3.9 था. अब उसका वेट 5.1 है. अच्छा, तो 2 महीने का 2 months है ना, तो 8 weeks, 8 to the 16, 1.6. तो 3.9, 4.9 एंड हाँ थोड़ा कम है, 400 grams कम है. पर जब भी वो ब्रेस्ट फीडिंग करता है उसके बाद भी वो डिमांड करता है, पर मिल्क नहीं मिलता तो वो रोता है. व्हाट शुड आई डू? मैं पंप भी करती हूँ जैसा आपने पहले का सेशन में बोला था, पर वो भी वर्क नहीं कर रहा है. मुझे फॉर्मूला मिल्क देना पड़ रहा है, जो मैं नहीं चाहती हूँ. तो सुमन, अगर आप और पंप भी कर रहे हो और आपके बच्चे का वेट भी नहीं बढ़ रहा है, बच्चा ऑलरेडी 2 महीने का हो गया है, तो आप कल ही रीच करिए टीम को, फौरन पहुंचिए टीम के पास, उनके साथ अपने डॉक्टर का अपॉइंटमेंट लगवाइए और इसको जल्दी से जल्दी रिजॉल्व करिए, क्योंकि आपका बच्चा ऑलरेडी 2 महीने का हो गया है और बच्चे का वेट गेन भी कम हो रहा है, उसको अभी भूख भी लग रही है, और आपने बोला कि आपका मिल्क सप्लाई भी लो है. तो अब कोई रीजन नहीं है कि हम उसका वेट करें कि मिल्क सप्लाई और इम्प्रूव करने का. हम वेट नहीं करेंगे, फटाफट करिए, नहीं तो ऑब्वियसली मिल्क सप्लाई, वो वेट अगर कम है तो डॉक्टर बहुत जल्दी आपका फॉर्मूला मिल्क स्टार्ट कराने वाले हैं इसके अंदर. तो अगर आप बचना चाहती हैं उस चीज के लिए तो जल्दी फटाफट काम करिए, जिससे मिल्क सप्लाई इंप्रूव हो और आपके बेबी का वेट इंप्रूव हो एक्सक्लूसिव ब्रेस्ट फीडिंग से. नेक्स्ट क्वेश्चन इज फ्रॉम विद्याश्री. Can I take Lactair tablets or any other supplements to increase breast milk? So Vidyashri, just go through Lactair tablet backside and see the composition. It has got preservatives added into that. So I don't suggest taking any preservative, like any supplements which have preservatives. If you ask me about preservative-free supplements, then I suggest Lactomagic powder and Morico tablets. Next question is from Rohita. Please give me pumping session protocol. I have premature baby already completed 3 months but doesn't latch, doesn't have the stamina. That's okay, Rohita. You can go for a pumping session protocol, but we need to first understand what is your whole day protocols, what is your whole day routine, what is your baby's weight, what is the expected weight gain which we want from the child, what is the demand of the baby, what we there are a lot of things which we need to understand first. We have a proper questionnaire whenever we ask a mother to reach out to us. So the mother fills in that question so that we know what is the status of the mother, and then we design the protocols as per the demand of the baby and what is the whole routine for the mother. So Rohita, you need to understand this and reach out to the team tomorrow and get your consultation done. Next question is from anonymous attendee. After feeding, still my baby feels hungry and cry. Also have low milk supply. So if your baby's after feeding session, the baby is still crying, then obviously there is either a supply issue or a latch issue or there is a flow issue. So today I have answered all these three things. First, try to work on it. If it is more than 10 days and you have tried on this and it is not improving, there is no reason to wait for this to improve by itself. Get an expert help as soon as possible. So Ankita Shea says, thank you, ma'am, for the answer. You are most welcome, my dear. Next question is from anonymous attendee. My baby latches on the breast but sleeps after 5 to 10 minutes of feeding. She again wakes up and feeds. Owing to this, I am unable to follow a schedule. Please suggest what to do. Should I pump when the baby sleeps? So what I would suggest, just make sure that the baby is latching deeply. So as today in the starting of the session, I told you about the deep latch technique, how you can make sure that the baby is latching deeply. So when the baby is latched deeply, whenever the baby in the like sleepy position, also if the baby moves the mouth, the baby will get milk and the baby will not be able to sleep. So this way, it will be better for you to improve the feeding sessions. So if this is not helping, and then obviously you can pump once the baby sleeps. Also, you can know whether the baby has taken proper feeding or not. After feeding, just check the color of the milk. If the color of the milk is thick white, that means your baby has not taken proper milk and the baby will get up very soon. If the color of the milk is thin white, that means the baby has emptied the breast and the baby will sleep properly now. Next question is from Sonali Gaikwad. I delivered a baby through C-section delivery on 18 December. After delivery on the 4th and 5th day, the doctor gave me injection for milk production. Last week, my gynecologist gave me tablets for 3 days to boost my milk supply. There is no improvement. My baby is not able to suck milk as my nipples are very flat. I tried almost everything. I tried to feed with my nipple shield and also tried an electric pump. My milk supply is very low, only 1 to 2 spoons. Once in a day, I massage my breast and with coconut oil and baby 3 to 4 times. A second time, when I try to feed baby through shield, milk doesn't come out. My baby is on formula milk since he is born. My baby can't hold flat nipples as area is very soft. I try to pull out nipples, but within seconds it returns to its possible and becomes flat. So Sonali, there are a lot of things which you have mentioned, but this is a clear indication that nobody has guided you properly. With flat nipples, you can definitely feed your baby with a cross cradle hold, because in that we are supporting the breast and pressing the breast so that the areola comes down out. The baby will be able to latch with the areola out with which is coming down when we are pressing the breast. So you can definitely feed your baby directly even with the flat nipples. But since your milk supply is very low, only 1 to 2 spoons, then obviously we can't expect the child to come on the breast regularly with such a low milk supply. So we need to first improve few things. We have to work on improving the supply. We need to work on improving the flow, and we also need to work and to teach you the latching and work on the latching to improve all these things. Since you have written a big thing and you have reached out to your doctor and they have suggested you some things, but it is not working in your favor. So I would suggest there is no reason to wait. Still, if you want to wait and keep trying, then I have given you tips and tricks for today. Just work for them. But if it is more than 10 days of trying and there is no improvement by yourself, there is no reason of waiting and letting the things to improve by themselves. Next question is from Usha. Ma'am, how to increase breast milk? Already answered, dear. Next question is from Vidyashri. My baby is 1.5 months old. Since he gained only 700 grams, is it low weight? So 1.5 months, it's 6 weeks. Okay, so 6 to the 12. The baby should gain at least 1.2 kg. I would have, be happy if it would have been even 1 kg also. But 700 grams, yes, it is little low. But if your baby is on exclusive breastfeeding, try to give more of hind milk to the baby. The baby will do good. Next question is from Kirti Verma. Good evening, ma'am. My baby is moving his neck during feeding. Is the feeding is not active? If yes, then what can I do? So if the baby is moving the neck, what you can do when you're holding the baby from the back side of the head, just try to have a hold for the firm hold. And also when you're holding the breast, keep holding the breast throughout the feeding session. So if you feel tiredness in your hand, you can keep a small stool nearby so that you can support your hand. So during feeding, if you support the breast from below and hold the baby firmly, the baby will not move the neck, and you can improve this now. Next question is from Jyoti Patel. Baby keeps rejecting one breast. Also after feeding on one side, I can't express milk from the other side. So that means one side supply is better than the other side, which is very common with most of the mothers. What you can do, start from feeding the baby from the side which is lesser milk supply. Then you move to the side where it is better supply, and at the ending, just get the baby on the side where the milk is less. So the more demand, the more supply. If the baby is not coming on the side on one breast, then you can create the demand by pumping. So just make sure that your demand supply chain is maintained, and the other parts which I advised on improving the milk supply, just work on them and it will improve. Don't worry. Next question is from Rani. Every 2 hours, I give 60 ml milk my baby and I pump 4 to 6 times per day. Okay, that's good. Next question is from Nandini. My baby is 1 month old and baby is latching also, but my breast milk supply is low, so giving formula milk also. I'm pumping 3 times a day, but both side I can pump only 15 to 20 ml both the sides. Then you need to work on the things which I have mentioned today. Try for 7 to 10 days by yourself. If it improves, that is well and good. If it keeps improving, that's very good. Keep working on it. But if you don't see a significant change in the supply and then please reach out to the team. Next question is from Kanika. Should we express milk at around 38, 39 weeks during pregnancy for feeds after delivery? No, I will not suggest that, because that will land you in premature delivery. Don't do that. Next question is from Hannah. How do I get in touch with you? Need my milk supply be normal with thorough guidance? So on the mail where you get details about the today's session on like mail you would have got email, just mail back there and ask the details, and they will send you the number or they will send you the booking, how to book the slot. Next question is from Revati. My baby is taking feed for more than 45 minutes, but still not satisfied. So if the baby is taking feeds more than 45 minutes, that is an passive feeding definitely. So just work on watching the active gulping movement. And once the feeding sessions are smaller and the active feeding is there, you will be able to create a better demand. So that will improve your milk supply. Next question is from Shruti. Baby weight gain is around 150 grams in the last week with 8 to 10 times of breastfeeding followed by formula feeds. What is the age of the child, Shruti? You should write everything all together, because I don't know what, because there are so many questions coming in here. I don't remember what has been there. So just let me see if I have any context with you, Shruti. So, Shruti, what is the age of the baby? Shruti. Shruti. Shruti, I don't have your baby's age. You should write properly about your questions. Shruti. The question is not there. Okay. So 150 grams in last week, if the baby is more than 3 months, that is perfectly fine. Next question is from Shivangi. Ma'am, I want my baby back on my breast as he has stopped coming and my supply also has gone and my baby 7 months old. Please help me with suggestions. So Shivangi, since the baby is 7 months old and the supply has gone down, then how can we expect the baby to come on the breast when the supply is really low? 7 months baby understands everything. The baby understands the flow. So first, Shivangi, work on improving the milk supply. Today I have given some suggestions. If you have never tried anything before, you can just work on it. But if you have tried previously some things and it was not working because baby is already 7 months old, there is no reason to wait and just try tips and tricks. Get on this journey fast. It is called as relactation, and get your issues resolved as soon as possible. Next question is anonymous attendee. Please suggest how many days can I use Lactomagic. So it will all depend on what is your supply, what is the demand you are seeking for. So first, usually we start with 2 scoops 3 times per day with Lactomagic and Moreco tablets, 1 tablet 3 times per day. But I would always suggest keep seeing the weight gain of the baby. If you're not seeing enough weight gain, then reach out to the team, because only eating something is not going to improve the milk supply. You need to work on all the other parameters to improve the milk supply. So just eating one thing is not going to help you in that way. Next question is from Debasmita Tripathi. From 2 days, my baby is on breastfeeding and still not passing stool. Should I wait? Yes, definitely you should wait. If the baby is on exclusive breastfeeding, not past motions for 2 days, you can definitely wait. Don't worry, Debasmita. Next question is from Nandini. When my baby latches, there is an itching in my boobs, not on my nipples. What should be the reason, doctor, and how should I overcome? So when the baby is latching, there is itching. It is a letdown reflex. Sometimes you will feel like small needles pricking in your breast. So it's okay. It is basically a letdown reflex, and which is very normal feeling. If you feel too odd or too uncomfortable, after the feeding session, you can just apply a little ice on it. It will just numb the area, and it will definitely be okay for that. Okay, so that's all for today. It was good seeing the questions and answering them. Okay, girls, so take very good care of yours, and any questions, anything, you can just message us on our next not feeding session, on our next live session, and I'll definitely answer it. But if you are facing any kind of issues and you want them to resolve as fast, please reach out to the team and get it resolved as soon as possible, because if you keep waiting, the things will not improve by its own. You need to work on it properly, and always a guidance is always good, because guidance means that they will be always keeping in touch with you. I have a dedicated helpline team who is there between morning 10 to 6 to answer your questions. So that way, when you get a proper support, there is somebody to ask you what is happening, what is the weight gain, everything that gives you better results. Okay, so take care everyone. Good night, and take very good care of yours and your babies. Good night.